If you have simple cuts and scrapes, what you must do is first clean off the wound. Either medical wipes or soap and water is available. Then next, apply a triple antibiotics ointment. After, follow up with a dry, sterile dressing or adhesive bandage. This allows the wound a chance to heal itself and prevent infection. Next, we have blisters, the most common injury. First, be sure to never pop a blister as it allows bacteria to enter your body much easier. Next, cover the affected area with a piece of moleskin. If the blister is going to burst, drain the fluid using a sterilized pin and bandage. This allows you to continue with your activity without infection. Next up, we have burns. Burns are common injuries, especially when cooking. There are three categories of burns. The first, which is first degree burn. First degree burn typically reddening of skin and mild irritation. To treat this kind of wound, simply run the wound under cold water or apply cold wet rag until the pain goes away. Note, never apply ice to a burn. A second degree burn are typically signified by blisters forming as the damage has spread to the tissue beneath the skin. For treatment, submerge the burn area in water or apply cold wet cloth until the pain subsides. Then cover with a sterile gauze pad. Try not to break any blister as it could lead to infection. Lastly is the third degree burns. What we should do is call 911 immediately and don't try to remove any clothing. It is could be fused with skin. Wrap the injury in a clean dry cloth and treat for shock until the help arrives. Insect bites are mostly small injuries, but they can lead to serious injury or death if the patient happens to be allergic to them. Ticks are small, hard-shelled creatures that bury their heads into your skin to feed. If you're bitten by a tick, simply use tweezers to remove it. Grab as close to the mouth of the tick as possible and gently pull it until it is freed from your skin. Wash the wound with antiseptic and apply antibiotic ointment after the removal is complete. If you develop fever symptoms, tell your doctor as ticks can lead to Lyme disease or Rocky Mountain spotted fever. Chiggers are very small spider-like things that feed on your skin. Chigger bites are almost unnoticeable until they drop off of your skin, so treatment is pretty much just applying lotion to treat the immense itching sensation for the bites generate. Spider bites are very common and most of them are harmless overall, but there are very large threats to humans such as that of a black widow or a brown recluse. If the victim suffers from swelling, redness, pain, nausea, vomiting, or other symptoms after a spider bite, get the medical attention immediately and treat for sure. Bees and horns won't usually sting, but sometimes the worst happens and they decide to sting you anyway for some reason. Scrape out the stinger with a credit card or pocket knife screwdriver blade and apply an ice pack to reduce swelling. Venomous snake bite can be seriously threatening to a person's life, and while relatively uncommon, you should be able to treat it in case of an isolated incident. Keep the victim calm and gently wash the wound site and remove any jewelry before the area swells. Cease movement and keep the bite of the approximate level of the heart. Don't apply ice or take any other actions towards their health. Call 911 and try to set the victim to help as soon as possible. Nosebleed may appear bad. The bleeding is usually not as intense as it appears and will stop after a few short minutes with minimal care. Have the person sit leaning forward. The blood does not run down back into the back of their throat and pinch firmly but gently high on the nose, just underneath the bone. Hold a cold compress against the nose and the bleeding should stop after no more than 10 minutes. If it continues for longer than 15 minutes, seek medical attention. If the person is choking, you cannot breathe or cough, tell someone to call 911. Begin treatment. Stand behind the person, then bend them over your forearm. Strike their back between the shoulder blades 5 times. If this does not clear the airways, position your arms around your waist. Make a fist with one hand and grasp with the other and perform up to 5 abdominal thrusts by thrusting your clasped hands inward and upward. Repeat this entire process until the airway is clear. Treat for shock if necessary. Injury, we will be covering a shock. Treat every accident victim for shock even there are no signs. Call for help. Be sure to eliminate any hurry cases that might be causing the shock, such as clogged airway or an open wound, by the person down and raise the legs about a foot above the rest of the body to move blood to the vital organs. Be sure to keep the victim warm with blankets or sleeping bags. And there you have it. There are all the basic first aid skills.